Good afternoon, and thank you for joining us today on the program Healthy Living. I'm Adesuwa Osa Owage. Today on the program, we want to look at some gynecological issue that may be bothering you. This is one area where women in particular do not like to speak up. You know, they just hide everything. Let people not know. Let people not know. But you see, you never can tell who will come to your rescue. And some don't even have this habit of going to the hospital. There are so many signs a woman ignores, and it is not good for you because at the end of the day, it may just kill you. There are so many signs men also ignore. You're seeing some signs, you're feeling somehow, and you do not think you should see the doctor. Then you are only creating more problems for yourself. And a lot of us do present late when the wahala don't too big, you know, when everything is, should I use street language now, everything don't over you, so to speak. That's when you now seek the assistance of a doctor. But by then, things might have gone wrong. So we're going to look at some common gynecological issue that can happen to somebody and how you can go about it. So I'm being joined today on the program with a consultant obstetrics and gynecologist. He was once the CMD Central Hospital here in Benin City, and he's also the CMD of remind me of the hospital of Fountain of Life. Yeah, Fountain of Life Specialist Hospital here in Benin. Fountain of Life Specialist and Fertility Hospital here in Benin City, Dr. Jerry Osa Owaifu. I'm happy to have you join us. It's been a while, almost 1 year now.
Pleasure, yes.
Who abandoned each other, me or you?
I think you abandoned me. I've been around, just keeping, trying to be silent, and then, you know, when you are retired, a lot of people forget you. Just like you forgot me.
Yeah, I won't dare do that.
But I'm still very much around.
I won't dare do that. It's a pleasure to have you join us today. All right, today on the program, we want to look at some common gynecological issue that can happen to somebody, issues that are actually treatable. But because of late presentation, it becomes a problem. So we're just going to start with some problems that may occur, and then we'll open our lines for you to call in to ask some other questions that you may have, some questions that you may want to ask. And our number is 052-290-573. The number is going to be on your screen when we are so ready to take calls. All right, Dr. Jerry, as a consultant in this field, we'll ask you quite a number of questions. You know, most women have complained about menstrual disorders.
Yeah.
And I need you to tell us more about menstrual disorder, what menstrual disorder is, how it occurs to women, and the types, if there are.
Well, when you say menstrual disorder, that's a very wide area in gynecology, because menstrual disorder may have to do with pain, may have to do with flow, duration of flow, you know, how it occurs, is it very frequent or infrequent, or does it occur once in a normal cycle? Okay, but we'll talk about what the normal cycle is, and so on and so forth. So you have a lot of issues that come into play when you talk about menstrual disorders. Okay, so but I want everyone to know that when a woman menstruates, when at the beginning of every month, once a period starts, that marks the first day of your period, and then from there you start counting. So most women have cycle length, that is the first day of one cycle to the first day of the next cycle is one cycle length.
Okay.
So it's a wide range. Some people have it 21 days, some have 24 days, some have 26, 28 days, some have 30 days, some have up to 35 days. But once it is up to 45 days, then it becomes very abnormal. Okay, and we have a name we call it oligomenorrhea.
Oligomenorrhea.
Yes, it's infrequent. It comes once in about 45 days. It's not normal. So when you have that kind of situation, you have to look into it and find out why is this woman having this kind of problem. But it's good to have a basic understanding that before a woman can menstruate, she must have eggs in the ovaries. And at the beginning of every cycle, eggs begin to mature. And when they mature, they release a hormone called estrogen. Then this estrogen will make the lining of the womb to start getting formed in preparation for a possible pregnancy. So if you get to about the middle of the cycle, then ovulation will occur. Once ovulation occurs, a different hormone starts coming out again, called progesterone. this progesterone will further make that lining of the womb to get ready in case that egg that was released is fertilized. So by the time the egg is fertilized, the fertilized egg, which is a zygote now, the embryo now comes back from the tube into the womb, and by then we expect the womb to be ready to receive it. So it receives it, and then the woman gets pregnant, and she will miss her period. But if there's no fertilization, then if there are other issues that prevent the egg from meeting the sperm from the man, then the egg would disappear. The entity that was formed that was producing the progesterone would disappear, and then that womb line that was formed is shed. That is the menstrual period that you see every month. It happens every month. So that's why we say menstruation is a cyclical flow of blood from the genital tract from the woman. It's occurs regularly and cyclically. Okay, every 21 days, this event I just described occurs. So, but you find that when you now have variations, like if it comes, it doesn't flow well, it's very scanty. Then you not to talk about hypomenorrhea, that is, it's very scanty. Then if it comes and it's very heavy, that's another problem again. We call it menorrhagia, which means the bleeding is too much, more than normal. By the way, normal menstrual flow for the number of days that you have it every month should be between 30 and 80 mils of blood. So you find that it will not be, once it's in excess of that, you start talking about menorrhagia, which means it flows more. And the way we normally assess it is to ask the woman questions. For example, how many pads do you use during your cycle? Or how many pads were you using before that is different from what you are using now? Yeah. Are you using more pad than before? And do you pass clots of blood? Because it takes heavy bleeding for some blood to accumulate there for you to have clots of blood coming out. So that's an indirect way of knowing if the woman is actually having heavy menstrual flow through. You know? Then apart from that, you can have pain during periods, either at the beginning or it will start at the beginning and occur throughout the cycle, throughout the bleeding phase of the cycle, or it will just come at the end. So all these will tell you different problems that may be there. If it's at the beginning, if it's throughout, if you have cramps, particularly if the woman was not having that kind of problem before, okay, and then suddenly she starts having that, they will know that there's problem. So we have what we call primary dysmenorrhea. Dysmenorrhea is painful menses. Okay, so if it's primary, which means right from when the woman starts seeing her period, okay, from the age of 12, 13 or whatever, she has been having that normal pain. But if all along the woman was not having that pain before, and suddenly she's not having pain, then one must be suspicious of something happening. Then one may have to take a look at the woman and find out why she's not having painful periods. Okay. And then one can now do examination, do investigation, and find out why. Okay.
Let me ask you this question, still on menstrual disorder. I don't know if this one is a disorder or not.
Yeah.
Okay, for some persons, we've realized that some little girls do start their periods at 9, others 10, some 12. So a question was brought forward by somebody, and when she asked the question, I said, I definitely have a doctor that will answer this question, that what makes a girl to start her period at maybe 10, and then she sees the period the first month, the second, the third maybe, then the fourth will not come, the fifth will not come, the sixth will not come, the seventh, maybe the 8th month the period will come, and it will last for 3 days. After that, the girl will not see the period again, maybe until another 3 or 4 months. You know, at intervals like that, is it a problem?
Yeah, it may not be a problem, but if it happens, it's good for one to observe for a while. If it continues, then the mother of the girl should, or parents of the girl should take the girl to see a gynecologist.
Like for how long should this happen before she goes to see
basically
a doctor?
what happens is that, you know, when a girl child is in the womb, okay, the ovaries are very important, and the brain is a very important part. The
Yes.
ovary, the brain, and the womb itself are important structures that take part in the menstrual cycle. You know, you find that when a girl child is still in the womb, and it's about 20 weeks, there are eggs, about 7 million eggs in both ovaries together.
Already?
Yes, already. Okay, by the time she's born, this 7 million eggs reduces to about 2 million. It comes down drastically. You know, and by the time she grows up to see her very first menses, it reduces to about 400,000. That first menses we refer to as menarche. Once again, when you do start seeing your period, that represents what we call menarche. The very first menses the girl is seeing. So about that time, the total number of eggs that are there is about 400 400,000. Can you imagine from 7 million to 400,000 by the time it starts? That 400,000, we call it ovarian capital. It's like this is what you have available for reproductive years, okay, and so on. So every month, 1 or 2 eggs will develop and then shed. And gradually, as the woman is getting older, the eggs are going down. But at the beginning, this system may not be very, very well coordinated because the brain plays a role. There are hormones that are released from the brain that stimulate the ovaries for the eggs to develop, to go through the process I described earlier on. The egg mature, estrogen is released, then ovulation occurs, the shell of the egg produces progesterone and so on. It may not be well established. And for that reason, at that beginning, the girl may see have irregular periods, okay, before it now becomes fully established. So it is normal. It's not unusual for you to see a young girl that starts seeing a period about 10 years, now having irregular periods, initially till she gets to about 15, 16 or 17. So usually we don't worry about that. Okay. They come, you just check them and reassure them that there's no problem. But where there's a problem is when a girl that is already fully matured, sees her period normally, maybe she's already 18, 19, 20. Okay. Her period is coming regularly, and then all of a sudden it ceases. It ceases. Doesn't come again for some time. That girl needs to be examined. The ovaries has to be looked at. And then one may have to do what they call hormonal profile. Because the hormones come from the brain, so hormones come from the ovaries and so on and so forth. So one has to look at all these things and make sure they are the way they should be. Okay?
Is it normal for a little child, maybe a child of a few months old, to be spotting?
Few months old?
Yes.
It's possible. What happens is that, you know, when the mother was pregnant with her in the womb, you know, she has high levels of estrogen, progesterone, okay, inside her. And that crosses the placenta to the baby. So when the baby is born, okay, this estrogen, progesterone supply is cut off from the baby. And then there will be, the womb is there already, it's small. But that womb also responds to the estrogen and progesterone that the mother is producing. That will make her, once she's giving birth to, that may not cause kind of what we call withdrawal bleeding from the genital tract of the baby, which may be perfectly normal.
Okay, it may be perfectly normal, so it's nothing to worry about.
Nothing to worry about, but if it happens, it's good to see a doctor to make sure there's no other problem.
Okay. All right, we're on the program Healthy Living on ITV. Start collecting your questions that you want to ask Dr. Jerry Osah-Uwaifo, be you man or woman, anything that has to do with your reproductive health. You can call in to ask questions, okay? You never can tell where your help will come from. Now, let's look at pelvic floor prolapse. Okay. How does it occur? How does it happen?
Uterovaginal prolapse, that's what they really call it. You know, there's a floor by muscles, and then the womb is held by supports. Okay, muscles and the ligaments and so on. It's like maybe when you look at the cotton that we used to have cotton those days. You have the string hanging the cotton. So if the strap string become weak, what happens to the cotton? The cotton will not sag. So that same thing can happen to a woman. Those supports become weak, and when they are weak, the womb that they are holding, okay, that those supports are holding, the womb will drop. That's prolapse.
Well, what could be responsible for that, for the weakness of the muscles?
The commonest cause of that problem is unsupervised delivery. Why? Why is this so? Because you find that there's a way labor is conducted that is normal. We monitor the woman until we say she's fully dilated. That is, the womb
is open.
It's open completely. But you find that in some centers or places, maybe TBAs and all that, they may not even know when the woman is fully dilated or not, and they start pushing against undilated cervix. So that weakens the support. Okay, and then women that have had very many babies, maybe like 6, 7, 8 babies, a lot of work has been done, then the support become weak. So by the time they now get to close to menopause, they have prolapse. Again, another important factor is the withdrawal of estrogen. Like I said earlier on, this young girl that's menstruating, as you are getting older, the eggs are reducing. Until the eggs become so few and becomes quality are now very low. They are no more having regular development of those pieces. They now have lack of estrogen. You know, that's exactly what happens in menopause. When that happens, estrogen helps the support as well. So what with the withdrawal of estrogen, this support will now become weak. So the factor I mentioned earlier on, plus low estrogen level, will now together make that the structures to be weak, and then the uterus will prolapse.
Is it possible for abortion to cause that too?
Abortion per se may not cause it, unless maybe they pull it by force. I don't know, but it's not likely. It's not a major issue that we talk about when we talk about prolapse.
So when such happens to a woman, what is she expected to do?
She should see a doctor.
Will she know?
Yeah,
what are the signs?
She will know. She will see that the thing is coming down. By the way, today I saw a woman that had that problem today. Okay, but this is a woman that is already at menopause.
Okay.
She's no more sexually active. Okay, the thing is already the thing is prolapsing already. So there are ways of treatment, but at that age,
when it prolapses, it comes out.
Yes, you start. When she coughs, the thing comes down. You have different grades. Some will now go down a little bit.
Okay.
Grade 1, it goes further. You see the cervix coming out. Then
you actually see the cervix coming out.
The extreme case is the one that you have the whole uterus and the cervix coming out. We call that one procidential. Everything comes out.
Okay.
So we find that the woman tries to put it back. The moment she gets up, cough, the whole thing comes out again. Yes, but some people may not have everything coming out, but they will feel it coming down, getting to a stage where even when they lie down, you can see it protruding out, the cervix itself protruding outside. Okay, you can have it like that. But the treatment of it is that it depends on the age of the woman.
Okay.
If it occurs in a woman that is already at childbearing age, you may do a repair, trying to strengthen the support,
okay,
so that the womb can go up. We have a procedure we call Manchester repair.
Okay.
We try to shorten the ligaments, tie it back to make it shorter. It will now become stronger.
Would it make the woman competent enough to have kids?
Yes, she can have kids, but you see, if she's desirous of many pregnancies, babies, then she may not develop by herself. But if she develops by herself and she goes on to push, that thing may occur again. So that kind of woman may end up having cesarean section for her deliveries. If it's a young woman of childbearing age.
Yes, and the one who is not of childbearing age.
Yes, of childbearing age, yes. If she wants to have children, more than one, okay, it can occur again if she tries to deliver by herself. So cesarean section will be the best option, okay? But for an elderly person, maybe already at menopause, the best thing to do is to take out the uterus.
Take it out completely.
Yeah, you remove it, you do what we call hysterectomy, to remove the uterus.
And the woman will still come out fine.
Sure, very well. If it's coming out that way, most times we'll do it from below. That is, we'll do from the below, remove the uterus. Okay, but if it's not all that down as such, and she has stopped having children, you can remove it through the abdomen. Okay,
would the woman not feel it, not have signs? Does it just come out immediately?
No, she will start having signs.
Is it an accidental thing?
No. Or it will start coming out. The woman will notice, but most times, most women ignore.
Okay.
Okay, for example, now most women try to watch themselves up. What your finger was not getting to before, suddenly you don't find that your finger is not touching something. It's enough for you to go to a doctor and complain that I feel something, but I was not feeling it before, but I'm not feeling it. One doctor examines you, a gynecologist examines you, he will know that you're having uterovaginal prolapse. Okay.
So what are other signs the woman should look out for?
Prolapse is coming down. It's coming down. Yes. Sometimes you can have a tumor, a mass inside the abdomen that can also push the womb downwards. Okay, they could call it knockdown syndrome or something. So the big mass in the tummy will press the womb, and then the womb will descend. Okay, that one can also cause prolapse. If that's the case, well, one can do surgery, remove that mass, and then you find that you have little work to do from below. Yeah.
All right, the program is Healthy Living on independent television. Our number is right there on the screen already. You can start calling in to ask questions, any question at all, and you will get an answer. Questions relating to the topic we are treating today. Now let's examine polycystic ovarian syndrome. What could this be?
Yeah, you see, polycystic ovarian disease or syndrome, as the case may be, you find that in the ovaries, like I said earlier, you have many eggs, but only few develop each time. Okay, every month a few, maybe 2, 3 develop, maybe 1 or 2 now achieve what we call dominance. They now grow bigger, and then ovulation occurs. But in a polycystic ovary, you have many tiny ovaries, eggs, or what we call follicles. Okay, they are arranged in a particular pattern, like around the periphery of the ovary, giving you a kind of picture. If you look at it, you use ultrasound to look at it, like a necklace. So we call it a necklace appearance. That's what it looks like when you use a scan to look at it. Okay. So the eggs just refuse to develop, to grow further. They refuse to grow further. They just remain that way. So that kind of woman may start missing her period, or her period will start coming infrequently, and then some of them may have hair in areas of the body, like a male. So once I see a girl that comes complaining that her period is not regular, and I look at her, she's hairy, she has mustache, she shaves mustache, she shaves her hair, she has hair on the chest, my mind will go to polycystic ovary because it's usually associated with it. Because it has to do with insulin resistance and then also the male hormone, androgen. Okay? But usually women that have hair like that, they have high levels of androgen. You know, so the diagnosis is very simple. Ultrasound, you will see it. You see the ovaries having this picture that I talked about. Kind of, you see the ovary, then you have the eggs, tiny eggs around the periphery of the ovary, giving you a kind of necklace appearance. You know when you wear a necklace, the way it appears, that's the way it looks. And the eggs will just refuse to grow further. They won't grow. Okay?
Is there anything that can be done to help such a woman?
They can be easily treated.
Okay.
They are treated, yes. You can treat them and a lot of them get better. Some of them may take a few months to respond. Some respond almost immediately. And
but until the woman goes to the hospital, she may not know what her problem is.
She may not know. She may not know. There's
no signs, no symptoms.
There's no way of knowing. But a doctor that has seen many before, you may see a woman with the complaints and then her features I mentioned earlier on. That may just come to your mind. Okay, that may come to your mind. But that doesn't mean it is the only thing that can cause it. But that is the thing that comes to the doctor's mind to check. You know, and once it's there, then you know what you are dealing with and you know what to do, no drugs to give.
All right, the number is 052-290-573. There are signs you should not ignore as a woman or a man, particularly a woman. Once you're beginning to have some kind of pains you do not understand, you know, painful and excessive urination and all of that, you should see a doctor. Hello, caller. Good afternoon.
Good afternoon, ma.
Yeah, talk to us. What's your name, please?
My name is Florence.
All right, Florence. Where are you calling from?
I'm calling from the expression.
Okay, go ahead with your question, please.
My question is this 4 years now, not seen my period.
Since 4 years now?
Yes, sir.
How old are you?
I went after 3 years.
Okay, do you have children?
I have 3 children.
3 children?
Yes.
Have you gone to the hospital?
I've gone to the hospital that the treated the session. I've treated it so many times. And after treating it, it rush. It's now rush. At least 1 more must be stopped.
How old are you?
43.
43.
Okay.
Well, at that age, what comes to mind is, oh, has she got into menopause? That's the first thing that will come to my mind.
At 43?
Yes, yes. Because as you grow older, like I told you, the eggs are now depleted in the ovaries. They become few. Though the average age of women at menopause these days that get to menopause, okay, is the last study that I'm aware of. They say 47, that's the average age. But you find that some women actually get there before 47, or some get there after 47. But on the average, about 47. So I've seen women at 40 get into menopause. I've seen women at 52 get into menopause. So it's quite possible. But I'm not saying that it cannot be due to any other thing. But I would think I'll have that at the back of my mind, that this could be ovarian failure. Ovarian failure because of menopause. Okay, yes. Because I exhausted the eggs in the ovaries. Because the eggs play a very vital role in menstruation. Eggs are no more there, so she will not menstruate. Okay? So, but that kind of woman has to be evaluated to find out whether it's just that issue or other issues that is responsible. Again, there are other issues that maybe the womb itself has a role to play. If there is, for example, what we call synecdoche, that is inside of the womb is now plastered together. The woman may have that kind of issue, like you said 4 years. You said for the past 4 years.
Yes.
So we ask her about her last delivery. How was it conducted? Was she ill after the delivery? Did she have infection? Because infection can cause synecdoche of the uterus. It's not just the ovary alone now. It's synecdoche of the uterus, and the woman may not see her period again until that thing is done. It's a kind of surgery is done.
Will the woman feel it?
She may not be having any pain anymore, but maybe at that time she had pains because of infection. Or some people, when they do CS, after CS transaction, they inadvertently, whoever did it may tie the thing, and then the whole womb inside the cavity becomes small. Okay? That kind of woman may also have problem seeing her period.
Hello, caller. Good afternoon. Good afternoon. Please tell us your name, where you're calling from, and ask your question.
My name is Joy.
All right, Joy.
I'm calling from Dubai.
Okay, welcome, Joy. Go ahead.
I just want to. I hear what the doctor is saying. I have a
Okay.
problem. And when I gave birth to one of my sons, after breastfeeding, stopping the breast, then my sister just stopped, not washing. I was
Your
sick when I
what?
was sick. And I don't know if when I went to people, it made this, say I've gone to the age that I will digest. I don't know
Okay,
what to do.
Joy, tell us again
Whether
what the
it's normal
problem is because I didn't
or
get that
I
part.
should treat myself or anything.
Joy, can you hear me, Joy?
Yes.
Okay, you said after giving birth to one of your sons, after breastfeeding, what happens?
Now,
After breastfeeding, what happens? I didn't get that part.
when I saw the breast, when I saw the baby breast, normal, because when I saw the
Joy, if you reduce the audio level on your television, we'll be able to hear you properly. If you reduce the audio level on your TV, we will hear you properly. So starting from when you stop breastfeeding, what happens?
when I stopped it, I did not see it.
Honestly, I didn't get that. Yes.
So when I stopped this one, it's not fun, it's not flow.
Okay, when you stop your baby breast, the breast did not stop.
The menstruation is not fun.
Okay, your menstruation did not come again. How many years ago now?
I'm just 43.
You're 43. How many years ago did this happen? How old is your last baby?
The baby is 2 years.
2 years old.
You see, again, you're going to call inappropriate lactation. I don't know for how long she breastfed. Okay, when you are breastfeeding, it can even affect menstruation. That's why you find that some women may not even see their period for as long as they are breastfeeding. It's when they stop breastfeeding that they will start seeing their period in some cases. But you find that when a woman is breastfeeding, there's a hormone we call prolactin that is released from the brain that helps to make sure the breast is still flowing. Okay, but by the time the woman stops breastfeeding, if that hormone does not go down, she will continue to lactate. So we not call it inappropriate lactation or what we call galactorrhea. That signifies that the prolactin level, that hormone, is still high, and when it is high, it affects the ovaries. It affects the eggs in the ovaries from developing, and if the eggs don't develop, like I explained earlier on, the woman will not menstruate. And she's 43 now. She may just from there go into menopause. But I'm not saying she's at menopause yet, but she has to go to a doctor that will check her properly, evaluate her, if possible, check all the things I'm talking about. And then treatment is very simple if that's the cause. If high level of prolactin, as I said, with inappropriate lactation is a problem. That one can easily be treated easily.
Thank you.
And she will get over it.
All right, when you're going to call, kindly reduce the audio level on your television set. Hello, caller. Good afternoon. Hello? Hello? 0522905573. The number is on your screen. Hello?
I was not talking very fast.
Hello?
When I went to Florida, I was one.
Okay.
I stopped just when I went to clean the hospital, not take the inspection. And I treated it. The thing will not wash it. And after some months, we stopped it. I treated it all the while.
Okay.
We call and stop.
Okay. Okay, the caller that called before this about her period. Okay.
That Florence, that was 34.
Yes.
That I had last for 4 years ago.
Yes. Then when you go to the hospital, they say it's infection.
Yeah, that's what they told me.
Then you. Okay, you get treated. Okay.
See, infection per se will not stop her from menstruating. That's the truth. It's the effect of the infection that may make her not to see her period.
Okay.
Okay, a lot of people that maybe they are doctors, maybe they are not really doctors, they may not be doctors, they will just say, oh, you have infection. You must, for that to affect your period, the infection must affect the womb itself.
Okay.
And then the womb will now have what we call uterine synecdoche. That is, the cavity of the womb is now kind of plastered together. There's no space. So that level of the womb that grows,
yes,
okay, in preparation for a baby, will no longer happen. And then that woman will not see her period. Okay, so it's the effect of the infection that will make her not to see her period, not the infection per se. Okay.
All right, I hope you got that. While we're waiting for other calls, Doc, let's quickly talk about uterine fibroids. Is another problem that women do have.
Yeah. Well, uterine fibroid is a common tumor of the womb of the woman.
Yes.
It arises from the muscle fibers, because the womb itself has the inside we call endometrium, the muscle fiber we call the myometrium, and then the covering that we call the serosa.
Okay.
Now, the fibroid seedlings grow from the muscle fibers on the muscle layer. So if it grows, it will either grow inwards into the cavity of the womb or grow outwards out of the cavity of the womb. But you find that in most cases, fibroids are not seen in young girls that have not seen their period. And then we also observe that once a woman gets old, okay, even though they have fibroid, the fibroid will start shrinking. So it means that there must be a factor that helps the fibroid to grow. And it's basically estrogen. Estrogen is the hormone. So I find that when a girl or a young lady doesn't start having children early, fibroid is more likely to grow to come out in such ladies.
Okay.
And then again, you also have some family history of fibroid. So you find that if you ask me what's the cause of fibroid, what I will tell you is that when you have delay in having children, fibroid will grow. In fact, we used to say that the uterus is eager to carry something, either with the 2F, either a fibroid or a fetus.
Okay.
So for women that start having children early, you find that the incidence of fibroid is quite low in such women. Okay, but women that delay having children, you know how they have a lot of fibroid. You observe that in those days when our parents, our mothers, they were all having children early, maybe by the time they see their period, by 16, 17, 18, they say we are old enough to get married. Fibroid was not so common. But now, because of the way the whole things are, they have to go to school. After school, they have to go and do NYSC. After NYSC, they have to look for a job. The man that is going to marry the woman, the same thing. He must have some basic things. So you find that the average age of marriage these days for women is now a lot higher. Most women get married at the age of 28, 29, 30, 31. And by then,
even 40.
Or even 40. By then, they will start having fibroid. So that makes fibroid very common. But fibroid is a disease that is known to occur in the black race. Okay? It's very common among the blacks. It's quite common. And you find that almost every woman has a fibroid seedling or the other. It's very common. But it may be there, and most times, the woman never knows she has fibroid. Except maybe when she goes to the hospital, it is detected. Sometimes the fibroid may be in a place where it will be inside the womb. Then it make the woman to be having heavy menstrual flow. Then sometimes it may be in such a place that the woman start having cramps, very severe pains during menses. Okay, again, that will tell you that thing was not there before. Something was not there before, but something has developed. And you come out one that is fibroid that is causing it. So you have all ranges of manifestations. Some of them may have infertility. That is, if the fibroid seedlings are growing and they are occluding the entrance of the tube into the womb, be blocking it. Then the one having infertility, she may present somebody that is looking for a child, and you find out she has fibroid that is causing the problem. So fibroid is a very common problem, but it occurs usually at a later age. So women that get married early are not likely to have fibroid. Even if they have, there will be small fibroid that may not disturb them. That's just the gospel truth. Treatment is straightforward. Removal of the fibroid for those that are still desiring children. Okay. Then these days we have technology that is growing. There's a machine we call a stereoscope that you can use to remove fibroid.
Let's quickly take this call. Hello, caller. Good afternoon. Hello.
Hello, ma'am.
Okay. Tell us your name, where you're calling from.
My name is Chloe, and I'm calling from Benin.
Thank you for calling.
Okay. I used to one way on my body.
You what?
Blood.
No, can you start again, please, dear?
I do see blood.
You see blood?
Yeah.
How old are you? You're 20. How often do you see this blood? Every day?
It is since last week.
Since last week?
Yeah.
Are you pregnant?
No.
Is it your period?
No, I've seen my period.
You have seen your period, but you are still seeing blood. Okay. Is it painful?
No.
So what could be responsible, doctor? I'm trying to do
Is
the
it-
doctor's
most
job.
cases, yes. What you are doing is that's the way the doctor will also ask her questions that will probably lead to an area that doctor will be suspicious that this may be the cause. You know, how old are you?
It is 20.
20. Okay. Have you been pregnant before? Have you ever been pregnant before? Okay. So you will need to see a doctor because it's difficult for one to just have a guess. But you are having bleeding through your genitals. So one has to examine you and find out what is causing it. It could be a local problem. It could be something that is in the womb. It may be a hormonal problem. So it's difficult for anybody to guess and say what is wrong with you now from what you are telling us. So our advice is to see a gynecologist so that you can have proper evaluation.
And at the end of this program, I'm going to call out a number that you can, do a follow-up with. Hello, caller. Good afternoon. Hello. Good afternoon. Can you speak up a bit, please? I think we'll just have to let you go. When you're calling us, 2 rules. You speak up 1, and then you reduce the audio level on your television set. Hello, caller. Good afternoon.
Hello?
Hello, good afternoon.
Good afternoon.
Please tell us your name.
My name is Joy.
All right, Joy, reduce the audio level on your television set.
All right, ma. Please, I want to ask the doctor a question.
Go ahead.
I'm pregnant and I went to UDC. She said I have a low-lying placenta. What's the cause?
Okay.
Low-lying
You have
placenta.
low-lying placenta, what we call placenta previa. Okay. The cause, well, I may not know, but so there are some factors that may encourage that thing to happen. For example, if you have had infections before and you have some addition within the womb like snaky that is mild, or if you have had a lot of procedures in the womb before like D&C and so on, so the placenta may now insert around that area where you have the scar in the womb, so it may be low, but sometimes it can just occur. But basically what it means is that it's now low, and then you now have the risk of not being able to deliver by yourself. You know, it's not, well, I won't call it a risk as such. You know, one may have to deliver you through the abdomen, depending on how it is. But if it's early, sometimes those that are seen early, before you get to time of delivery, they may go up and go away from the cervix, from the level of the cervix. And if it happens, then it means you deliver by yourself. So it depends on how bad it is, what grade it is now, and how old the pregnancy is. Okay? How many months is your pregnancy now?
5 months.
5 months. So it's still quite early. So there is hope. Usually at about 36 weeks, a scan will be done again to reevaluate the location of the placenta. So most times you have what we call placenta migration. It will migrate up and go up, and it will not be an issue.
Is this
So
something
don't
she
worry
should
for
worry
now.
about?
Eh?
Is this something she should worry about?
No, don't worry about it at all. Just wait. By that time, you may not even see it there anymore. Okay. Thank
Hi,
you.
you're welcome, Joy. I share in that your amen. Oh.
Yes, yes.
All right, 0522905573. Give us a call. Ask the doctor any question. Hello, caller. Good afternoon.
Hello. Good afternoon.
Good afternoon. What's the name, please?
My name is Betty from Upper.
All right, go ahead with your question.
I want to ask the doctor a question.
Go ahead.
Please, sir, is it possible for somebody to go for a scan when you are pregnant and there's no placenta previa, and at the end when you want to give birth, it's time to push when your cervix are dilated to 10%. So they now discover that placenta block baby.
No, placenta has done what?
That is Placenta
when
blocked.
I did a scan,
Block the road.
no placenta previa. The scan was, it told me that everything is perfect.
Okay, everything's perfect. There's no placenta lying low again, Abi.
Yes.
That's what I just explained to you. If you were
When I was-
listening, that's exactly what I explained to the other lady that called just now. At the beginning of pregnancy, okay, you have a lot of things forming around the womb. Eventually, the part of it that will become the placenta proper is the one that will remain. The other part disappears. So at that beginning, you may have part of the placenta lying low. And once it's lying low, you call it placenta previa. But sometimes, by the time before you get to time of delivery, usually at about 36 weeks, we will evaluate you again and find out what the location of the placenta is. Most times, you can have what we call placenta migration. You can go up, and then everything will be normal.
Is it possible for the placenta to block the passage of the baby?
Yes.
I'm sure that's what she's asking.
Yeah.
What was
Something
it?
like placenta in the scan. It
What?
was not sure. They said the scan was okay. The scan was perfect.
Okay.
But it was the day of delivery. The placenta just fell. Is there any possible issue like that?
No.
The idea of the delivery.
No, which one came out first? Was it the baby that came out first or the placenta that came out first?
It was the placenta want to come out. Now block the baby. They have seen the baby head already. So the placenta just fell, and according to the doctor,
It blocked the road, eh?
to CS. Yes.
You now have to do CS. It means that the ultrasound they did before was not properly done. Evaluation was not properly done. That's the thing. Because there's no way you can just jump down like that. It was there before. You know, ultrasound is observer dependent. It depends on who is doing that scan. Some people may do it and they may not see it, and whereas it's there. So that is why you must go to a place where you know people that are doing it are doing the right thing.
Okay, sir.
A lot of people are doing all kinds of things now, doing scan every corner.
2021, I was also pregnant, and the pregnancy was last for 3 months. I lost the pregnancy. I was bleeding again. I was also bleeding. So I was rushed to the hospital. They evacuated me. But I started feeling pain on my knee. My knee will start shocking me. I went to see a doctor and explain. The doctor said nothing is wrong with me, that the thing will stop.
So you lost the pregnancy.
I went to Central Hospital to see doctor. That was December. I lost a pregnancy of 3 months old.
In December.
I was bleeding. So I now rushed to the hospital. So they evacuated me. They said the pregnancy is no match. Go for a scan. When they did the scan said no pregnancy. So they did the evacuation. So when there was this evacuation, my leg was shocking me when I get home. So ever since, I was just thinking it's not nothing to stop.
What was shocking you?
Normally, I always go to
Your legs.
Central Hospital. So I now went to see a gynecologist. Now told me that the pain is just normal, that the pain will stop. I explained to him what happened, that I lost 3 months pregnancy out of bleeding. They evacuated me. So from there, I feeling this shock on my knee, shocking me. So the doctor examined me, said it will be fine, that I should not be afraid.
Are your knees still shocking you now?
The thing is reducing. At times it reduces, at times it come up, at times it reduces,
You see,
at times it come up.
my dear caller, let me tell you. You see, the fact that your leg was shocking you does not mean it's the evacuation that caused it. Okay, if you lost the pregnancy and you have retained products, now naturally those retained products have to be removed. If they are not removed, you may have more problems. You can become infected, like having something that is dead inside your body. It will attract infection, and that may affect your whole uterus, your tubes, and may give you chronic pelvic pain eventually. So the right thing to do is to do evacuation. I'm not sure that shocking that was opening your leg was because of the pregnancy. So anything can happen, and then definitely some symptoms will disappear.
I feel up.
Okay.
You look as if I'm having fever. I went for malaria test, typhoid test. They say it's negative.
Okay, you know what will happen? I'm going to leave a number with you at the end of this program. So you call that number.
You're not listening to what the doctor is explaining. You're just talking. When you talk, you hear the answer from the doctor first. You have led the first one, you are going to malaria.
Okay, don't worry. At the end of this program, I will leave a number for you to do a follow-up with. Okay, let's give space for other persons to call in now. Hello, caller. Good afternoon. Are you going to reduce the audio level on your TV set or what?
Hello.
Hello.
Good afternoon.
Good afternoon. What's your name, please?
Charity.
All right, Charity, where are you calling from?
I'm calling from Benin.
Okay, go ahead with your question, Charity.
I want to ask the doctor a question. Is it possible somebody is pregnant at the early stage? When I went to hospital, the first scan was normal. The second time, the scan was normal. So when the pregnancy was 5 months, when I went to scan, then I said there is sign of fibroid.
There is what?
Fibroid.
Fibroid.
And they said the baby is okay.
Yes, it's possible for you to have fibroid. What it means is that maybe those that did the first 2 scans didn't really bother about the fibroid. They didn't pick it. So that fibroid must have been there before the pregnancy started. And it was still there. Maybe the doctor that now did it that was more thorough and also that you have fibroid as well. So there's nothing wrong with that at all.
The baby is a year old now. So the fibroid is still there. It will cause any delay in another pregnancy.
Look, it depends on, you see, a lot of people have fibroid. It depends on the size, it depends on the location. Before you start worrying about it. There are some fibroids that are dead, they are not causing problem. You ignore it and leave it. Almost all women have fibroid, one form of fibroid or the other. If it's not giving you any problem, don't bother about it. It didn't disturb your delivery. You deliver normally now, and it's not causing you any problem. So ignore it.
Yes, I deliver normal.
They ignore it. It means it's not a problem. Yeah.
All right, 0522905573. Do give us a call. Ask your questions, okay? Because I know immediately after the program, people will start calling in. Do your calling now and ask doctor any gynecological issue you want to ask. Hello, caller. Hello, good afternoon.
Good afternoon, sir.
Yes.
Good afternoon.
What's your name, please?
My younger sister, she's pregnant. She went for scan, which was normal. But the late pregnancy is 37 weeks now. She went to a scan 3 days ago. They said they discovered fetal garlic mass. Then another one.
No, say it again. What did you say?
Fetal adrenal mass.
Fetal what?
Fetal adrenal mass.
Adenoma.
Yes, adrenal mass.
Adrenal mass. Okay, fetal adrenal mass. That is, it means like a growth in the baby's kidney. That's what it means.
I don't know, sir. Is there anything they will do that will not change that?
Well, it depends on what that mass is doing in the baby's kidneys. It depends. Well, I know in developed countries, they have intrauterine care for babies like that. They can actually treat babies that are still inside the womb. But I don't know of any center in Nigeria where that is done. You know, there was a popular Nigerian doctor that brought out the baby from the mother's womb, did surgery on the baby and put it back into the womb. So all these things are possible. A Nigerian doctor was the one that did it, and it was the first of its kind. So it's quite possible to treat that baby. So depending on where your environment and where you are, okay?
They will say how to use this.
Huh?
They will say how to do this.
Okay, fine, yes. That's the right thing to do. When they get there, they will look at it and see if that is compatible with life for that baby. If it's not compatible with life, okay, fine. Pregnancy will go on, delivery will take place, and then they will see if baby is alive. Then they will see what way to go, which way to go, and what to do for that baby to make sure the baby is fine.
Okay, sir.
Yeah.
All right, we're going to take our very last call now, and we'll see what we'll do after that. Hello, caller. Good afternoon. Hello.
Good afternoon, ma'am.
Good afternoon. Please tell us your name and ask your question.
My name is Ame. I'm calling from Benin.
You're welcome. Please ask your question.
I have a child who is just 10 months old now, but I'm saying that I want to
hello?
see the doctor.
Hello?
Hello?
I cannot hear you. Can you speak up a bit?
I think I have 10 months baby now.
You have what?
10 months baby. Just for 10 months now. Hello?
I honestly can't pick you. Hello?
We can't hear you.
I said I have a baby in my house who is 10 months old now.
Okay. A baby who is
I'm
10 months
pregnant
old.
now. Yeah, I'm pregnant now. So ask the doctor if I'm able to breastfeed him or I should call the same.
Okay.
Okay.
Okay, you have a baby that is 10 months old
And she's
and you are
already
pregnant again. Well, you may have to wean that baby off breast because as you are pregnant, you have a lot of hormones inside you, estrogen, progesterone, and some other hormones that you can transfer from your breast to the baby and may have some other effect on the baby. Okay, so gradually, I think you wean the baby off breast milk.
Okay, so the 10 months old baby is automatically going to be off breast milk.
Okay.
Why didn't you go for family planning? I'm sure that pregnancy occurred by mistake. It's not what you really desired. So maybe for this, after this one, now you try and go for family planning, okay? So you can plan when and how many number of children you want to have. You can plan. You can actually plan it, okay?
All right, that will be our last call for today.
Yeah.
Women, men, you should not ignore some signs. When you have some feelings, when you're seeing quite a number of things that are not usual, like your menstruation, you have painful intercourse, you have excessive, painful or excessive, pains in your genital when you're urinating, you have irregular period, you have changes in your breast, you have changes in your vagina, you're spotting, you have excessive bloating, you are having some discharge from everything that we've talked about today. Don't ignore those signs. Simply go and see a doctor. And to do follow-up, please call this number 08039506666. 08039506666. That means you're going to call 46.
Can I give another number?
Okay, go ahead. Quickly give another number that we can.
I'll let them calling this other number.
Okay.
070 595 700 70. I'll repeat. 070 595 700 70.
All right, that's the number you should call immediately after the program to do a follow-up, because I know that a lot of persons will want to speak with the doctors, particularly those who do not want their voices heard on air. It's all right. This is all we're going to do today, and thank you, Dr. Jerry Osawaifu, for finding time to be with us on this program.
It's always a pleasure to be here.
Thank you. We're going to do this again soon enough, all right? Monday is another day. Bye-bye.